Hello, everyone. Today I have the honor to be joined by Senator Lewis. Senator Lewis has been serving the Great Boston area for the past 6 years and oversees the towns of Malden, Melrose, Reading, Stoneham, Wakefield, and parts of Winchester. Now, without further ado, Senator Lewis, I'd like to thank you for being here, and can you please provide a brief introduction about yourself?
Thanks, Aria. It's great to be with you. And I want to just start out by thanking you for this fantastic project you've been doing and helping keep us all well informed about what's happening with the COVID-19 pandemic. It's really important, I think, that everybody gets, accurate information so they can make, good decisions for themselves and their family. So as you said, I'm privileged to serve as the state senator for a number of communities in our area. And in addition, I also am the Senate chair for the Education Committee. So a lot of the work that I do, in addition to constituent services and supporting a lot of local projects and initiatives, a lot of the work I do focuses on education, improving quality and equity in education, and also in healthcare as well.
Right. Now, to dive right into the questions, I know that two issues that you strongly care about are high quality public education as well as high quality healthcare. So in your eyes, how do you believe that these two things have been affected in light of this pandemic?
Well, dramatically impacted, of course. And, we just don't have, any real experience dealing with a public health crisis like this. We haven't obviously seen a global pandemic on this scale in a century. So it's been, very challenging for everybody to respond to it. Obviously, our healthcare system, both our hospitals, and our public health system has been on the front lines of helping to contain the spread of the virus and to educate us on the strategies, that we should be all following to keep everybody safe. And then it's been a very tumultuous for our schools as well, for our elementary and high schools, as well as our colleges and universities. And they've had to also very quickly respond to the virus, and it's been very very difficult, and we're still continuing to learn every day, and unfortunately we still face a lot of uncertainty going forward.
Right. Now, what has been the role of the Prevention for Health Caucus, which is a group that you co-founded and co-chaired during this pandemic?
Yeah, so actually that was something I helped to found quite a number of years ago, well before the pandemic. But it has been, very instrumental, in how we respond to the pandemic, because one of the things that we don't think that much about until we have a crisis upon our hands is public health. Public health is often in the background, whether that's, making sure that, the food we get at restaurants is safe, and, the water we drink is safe, and, we get our regular vaccinations and flu shots and things of that nature. A lot of these things that happen that we don't really think much about until, of course, we do have a crisis like this. So the purpose of that caucus and the work it's been doing for a number of years has been to get more focus on public health, on prevention, and being more prepared for a range of challenges, not like this pandemic, but others as well. And early on, when the pandemic first hit, we pushed for legislation which was passed and signed by Governor Baker, which is helping to strengthen our local public health departments, in Winchester and in other communities, so that they have the resources they need to do their job and help keep us safe.
That's fantastic to hear. So do you believe that this pandemic has hurt small businesses equally? Now, this is a question that I personally have been really intrigued by. And just as a point of clarification, I mean, do you believe that in certain industries, small businesses are thriving while in others, unfortunately, they are struggling?
I mean, there's no question that this pandemic has affected businesses of all sizes and nonprofit organizations as well. Differently. I think for the most part, it's been been a big blow to most organizations and particularly small businesses. I think just the fact that so many businesses had to close, earlier this year, and even now, have to operate if they're allowed to be open, they have to operate under, certain restrictions. Has made it extremely challenging. Then you combine that with the fact that we've gone into a major recession.
Mm-hmm.
We've seen obviously very high rates of unemployment, and
Mm-hmm.
that affects people's ability to affects consumer spending. So it's been very hard across the board. But certainly businesses like restaurants and hospitality and folks that are in industry sectors that have been most directly affected by the pandemic are bearing the brunt. And we're trying to help them as much as we can through various state programs, and also we've been very appreciative of the assistance that we've gotten from the federal government, from Congress through the CARES Act. And we're very hopeful that there will be additional assistance coming from the federal government because we do desperately need that.
Um, so next, how do you believe had workforce, sorry, demands have changed during the pandemic, and what do you foresee changing as we recover?
Mm-hmm. Well, I mean, it's really been, I think a tale of two cities, so to speak. We've got those who are fortunate enough to, have jobs that are allow them to, work remotely. They have been able to generally carry on, working from home or other remote locations, and they face their challenges, but not having to commute every day and has been has been a positive, I think for many people, and has saved a lot of time and allowed them to be more productive. On the other hand, we have many other people, whose jobs demand that they have to be there in person, in a hospital, in a in a store or another business, on the front lines of our emergency responders, police officers, firefighters, so many other grocery store workers, so many other essential workers. And they've really they are heroes. I mean, they have had to continue to do their jobs, so that our the society continues to function. And in many cases, they've had to even put themselves and their families at risk. So, we need to continue to do more to support those folks through things like making sure that people have the health care they need, the emergency paid sick time that they need, hazard pay, and other ways to make sure that we are trying to provide as much support and equity as possible for all different types of workers.
Sure. Now, this next question kind of relates to public education, and I was simply curious on what your thoughts on having equipment in schools such as testing kits. What your thoughts on this are, as schools have already begun to reopen and some are shutting down while some are still in the reopening process.
So it is definitely the case. I mean, if you listen to all the public health experts, and that's who we should be listening to, just like you point out on your website, right? That's where we should go to get our, credible information from public health and infectious disease experts at the Massachusetts Department of Public Health, the CDC, and other public health experts. All say that testing and then contact tracing, are critical parts of our strategy to contain the virus. So that's true within our schools, just like it is within, other organizations. So making sure that we do have access to testing that is, easy to access, convenient. Doesn't cost you any money to get a test, because it's either covered by insurance or covered by, state or federal dollars, is critical. And we still have a ways to go. I mean, we've come a long way to improve testing access, and I think in general, Massachusetts has done a good job, compared to other states. But we still don't have enough locations, and it's still not as easy and convenient and as quick as it needs to be for people to get tested, and that is a critical part of our strategy going forward.
Right. And I was curious what your thoughts on the hybrid model that most schools, it's been pretty similar for most schools, have been proposing for the reopening. Do you believe it's sustainable? Do you believe that we should, I know there are some believers that we should just be waiting the first few months just to wait the pandemic out and see if we can take a few steps forward before we start reopening schools. What do you believe is the right scenario? What the solution we should go with in terms of reopening schools?
So it's a very difficult decision, that each community, each school district, has been wrestling with for a number of months now. And I honestly think there's no one size that fits all. The answer in terms of what works best for any particular school district, does depend on a number of factors. Obviously, what is happening with the virus in that community, in that region. What kind of facilities they have, how much space they have to be able to bring students and staff back in and be able to still physically distance them. What the transportation demands are, in that community in terms of getting students, to and from school, as well as teachers and other staff. So you have to consider all those factors. And I think a lot of thought and effort starting back in June, went into planning what were the options, in each school district, and then what was the best decision. So, so far it appears that, districts like Winchester that have gone with a hybrid model so far seem to be having, pretty, success with that.
Mm-hmm.
And, we've seen generally the virus has been pretty well contained. But we're going to have to continue to watch it closely. Obviously, we're concerned about what happens as the weather gets colder. And, if we do see an increase in the spread of the virus, it is certainly possible that more school districts will need to go fully remote. But certainly our ability to go fully remote and the districts that are already fully remote right now is vastly different from what it was back last spring in terms of students having the technology they need and teachers and administrators and families being better prepared, which is not to say it's still not very challenging.
Mm-hmm.
It is, but at least we're in a better place than we were last spring.
Right, and I couldn't agree with that statement more. So what do you believe that our country's biggest misstep was or is in handling this pandemic?
Unfortunately, we've had a real failure of leadership at the national level, and obviously it starts right at the top with with our president, but also other national leaders who haven't unfortunately who have not been listening to the scientists, listening to the experts, and and did not again the president of this country and others in his inner circle still do not take this seriously. And so we never really responded with a clear coherent national strategy. We didn't really mobilize fast enough the resources like personal protective equipment and test kits that we need. And so we unfortunately, you look at around the world, the United States has been, had one of the highest, certainly number of individuals who've been infected, and tragically, one numbers of numbers of people that have been killed, by this virus. So at the state level, I think, we've tried to do the best we can, locally in Massachusetts, but, there are limits to what our resources are and what we can do without a strong, clear national strategy and resources. So, I'm still hopeful that we will improve our national response and, take this threat more seriously, because if we don't, it's both a risk to our public health, of course, and it also continues to be a grave risk to our economy as well.
Right. And I'd like to reiterate what you said and emphasize the fact that we should be listening to science over some leaders who say the virus is a joke, which I can assure people it is not. And everyone should be alert and worried about catching the virus and not going around nonchalantly as if it doesn't exist. Now, hindsight being 2020, is there anything that you wish you would have done differently to combat this virus, specifically you or in the state of Massachusetts?
Mm-hmm. There is, one of the things, the areas that I think we had a great tragedy, in Massachusetts, in our own communities, has been what happened in our nursing homes, and we have so many of our elders, so many vulnerable people, back in March, April, May, who we just didn't adequately, foresee what was going to happen. We didn't adequately protect them.
Mm-hmm.
So many of those, folks caught the virus in nursing homes, in assisted living facilities, in the Soldiers' Home in Holyoke. And because they were, of their age and underlying health conditions, they were very vulnerable. And so, we saw thousands of deaths in those places. And, we should be protecting our most vulnerable, whether
Right.
it's our children, our seniors, people with disabilities. There's no more important function I think, for our society, for our government, than to protect those who are the most vulnerable. And unfortunately, we failed them, in those early months. I think we're in a much better place now. And we certainly learned lessons, and we have taken actions, but I wish we could go back and do that differently.
Right. And I like to look at the bright side. On the bright side, we hopefully will not be making this mistake again, and we will be a lot more aware when dealing with any situation that arises. Now, finally, do you have any parting thoughts you'd like to add?
Well, I just want to echo what you said a moment ago about, taking this virus, this public health threat seriously. And I wanted to just make a point about that, which is it is about obviously protecting yourself, and as we know, everyone is potentially vulnerable to this virus, and certainly can catch it and can have, and it can be very serious, in anyone, a person of any age. But in addition, the reason we have to take it seriously and follow the the guidance from public health experts is because we need to protect each other, because there are many people who may have the virus and may not know about it, because not everybody's symptomatic. And so by taking the precautions like physically distancing, wearing a mask, avoiding indoor gatherings, large indoor gatherings, you're not just protecting yourself, you're protecting other people as well. And we're, at the end of the day, we're a community, we're a commonwealth, we're all in this together, and that's why it's so important to follow the guidance, because it's protecting yourself, your loved ones, and everybody else around you.
Right. And that's exactly what I've been trying to preach. That's what we need to emphasize. We're all in this together. So one thing that you can do can have an impact on tens, if not hundreds of people in certain situations. Now, I'd like to thank you for joining us today, Senator Lewis. It was really a pleasure to be learning about what you're doing to help us curb the spread of the virus, and recover both from the virus. So thank you so much.
Again, it's my pleasure. I want to thank you for what you're doing. It's fantastic, and just want to wish everybody to stay safe, be well, and we will get through this together.
Thank you.